You're welcome back. Now, the Lagos state government has announced a statewide immunization campaign in response to recent outbreaks of vaccine-preventable diseases, including measles, yellow fever, diphtheria, and cholera. The campaign aims to immunize approximately 21 million residents against diseases such as measles, yellow fever, and HPV. Health officials emphasize that strengthening routine immunizations is critical to bridging the immunity gap across communities. In a related initiative on maternal health, the federal government has introduced free cesarean section for poor and vulnerable women nationwide. Health Minister Ali Pate made this announcement at the launch of the Maternal Mortality Reduction Initiative in Abuja, underscoring the government's commitments to improving maternal health outcomes across the country. Now, to talk more about this, we're joined by a nurse in public health practitioner, Rashida Sani Afolabi. You're welcome, Rashida. Thank you for joining us this afternoon.
Thank you for having me.
Now, let me start by asking what prompted the inclusion of HPV vaccines in the current immunization campaign.
Okay, ordinarily, the HPV vaccine, which is a form of immunization which we give 9 to 14 years age girls, is not really a new vaccine, so not that we haven't been doing it before. Initially, we rolled out late last year, and this is just another opportunity to give a chance for those that were not vaccinated last year, and also there were some girls that were not up to 9 years, that were 8 years and below. So this is an opportunity to vaccinate as many people as possible, considering the fact that the human papillomavirus virus is a highly, should I say, it's a virulent one, and given its the effects in later life within the female group, because what it does, the human papillomavirus, what it does majorly, being a sexually transmitted infection, for everybody that has been sexually exposed at one point or the other has an increased chance of having contracted this infection. So it's an opportunity to vaccinate girls of this age range, which between 9 years to 14 years, because it's expected that they ought not to have been sexually exposed. So it's an opportunity to stimulate the immune response way ahead for later life when they become sexually active.
Now, noticing that HPV is something that people are exposed to when they're older, especially the girl child, and then it's been included in this campaign for vaccinations now. So how has the public responded to the HPV vaccination inclusion itself? Okay,
remember I mentioned that we started last year, I think the first week in November to be precise, but being that it's given free, then it was free, and even now it's free. But, you know, on the average, we have a very good response. However, sometimes you have outliers where people that were not adequately informed about the importance of the vaccine, and all they heard was probably the sexual aspect of it, not knowing that it's even an opportunity to prevent sexually transmitted infections and even cancers in later life. So by and large, last year was not as effective as it was here in terms of acceptability. But lately that we started this round of the vaccination, it's been massive. The demand has been so high, and we are happy that people are better informed. Just the way we are doing right now is an opportunity to further educate people and to get the right information from the right sources.
Is that also how the yellow fever vaccine works, that it's been administered early in life? Is that to protect against something that might happen after?
Absolutely. All vaccines, right from the time the child is born, usually the day the child is born, we start vaccinating the child, given the advantages of immunization. So the child, when given BCG, and all we give is to protect against such vaccine-preventable diseases in later life. So for yellow fever, it's usually given at 9 months, routinely with measles vaccination. But because of the pockets of cases that have been reported across the country, it's been quite alarming, unlike what used to be. So because of various factors ranging from our population, hygiene, and the likes, That's one of the reasons why we are doing this. And we've had cases also in Lagos State. So that's enough is an indication for the vaccination. So we give this to adults and also children, but the range we are giving is from 9 months up to 44 years. So for the children, is a second opportunity for them to be vaccinated against yellow fever disease, which you know is a highly virulent disease and can be very fatal because it's an hemorrhagic disease. Then for adults, is a first opportunity for those that were not vaccinated earlier. And for those that were even vaccinated at some point in their life, it's also another opportunity to boost their immunity against the yellow fever disease.
It's a very laudable project being undertaken by the Lagos State government. One has to wonder, however, if this is restricted to urban areas where people have access to plenty of information. What about the hinterlands, the villages? How has this project pushed into these places to make people more aware of the vaccinations?
That's a very brilliant question. And sincerely, the good thing about vaccination and activities like this, we refer to it as supplemental immunization activities. It's just like the routine immunization. The essence of this is just to strengthen the existing routine immunization activities that actually takes place. Now, for these activities, unlike before where we are restricted or not really restricted, we stay within the health facility and wait for the clients to come bring their children to get vaccinated. But for the purpose of this, we have to go all out. We've been to everywhere, both the hard-to-reach communities, even over the land, interlands, everywhere, just to ensure that no one is left behind. Because the more people that are vaccinated, the better for us, which we refer to as the herd immunity. When majority are vaccinated against a particular disease or infection, it increases the chances of being a better immune community and reduces the cases of infection. So whether urban or rural, it's everywhere, and it's even been conducted in other parts of the country. So it's just that Lagos State is just having its own round of the implementation.
Well, Rasheedat Sani Afolabi, we want to say thank you very much for joining us to tell us more about this project. Thank you very much indeed.
Thank you for having me.